Male infertility is a topic that is often spoken about quietly, sometimes awkwardly, and many times not spoken about at all. Yet it affects millions of individuals and families across the world. When couples struggle to conceive, the burden is frequently placed on women, while male factors are overlooked, misunderstood, or even denied. Today, it is important to bring this subject into the open, to speak about it with clarity, compassion, and scientific understanding, and to remove the stigma that surrounds it. Infertility is defined as the inability to achieve pregnancy after 1 year of regular, unprotected sexual intercourse. What many people do not realize is that male factors contribute to nearly half of all infertility cases. This means that male infertility is not rare, not unusual, and not a reflection of masculinity, strength, or worth. It is a medical condition influenced by biology, lifestyle, environment, and health, just like diabetes, heart disease, or high blood pressure. At its core, male infertility usually involves problems with sperm. This may include low sperm count, poor sperm movement, abnormal sperm shape, or problems with sperm delivery. Healthy fertility depends on producing enough sperm, producing sperm that can swim effectively, and ensuring that sperm can reach and fertilize an egg. When any part of this complex process is disrupted, fertility can be affected. The causes of male infertility are diverse. Hormonal imbalances can interfere with sperm production. The brain, pituitary gland, and testes work together in a delicate system to regulate testosterone and sperm development. When this system is disrupted, whether by medical conditions, tumors, or certain medications, sperm production may decline. Genetic factors also play a role. Some men are born with conditions that affect the development of the reproductive organs or the production of sperm, sometimes without any visible symptoms until fertility is tested. Physical conditions are another important factor. Varicocele, which are enlarged veins in the scrotum, are among the most common and treatable causes of male infertility. They can raise the temperature of the testes and impair sperm quality. Infections, especially those affecting the reproductive tract, can damage sperm or block their passage. Prior surgeries, trauma to the groin, or conditions like undescended testicles can also have long-term effects on fertility. Lifestyle plays a powerful and often underestimated role. Smoking, excessive alcohol use, and recreational drugs can significantly reduce sperm count and quality. Obesity alters hormone levels and increases scrotal temperature, both of which negatively affect sperm production. Poor diet, lack of exercise, and chronic stress further contribute to hormonal imbalance and reduced fertility. Even exposure to environmental toxins, such as pesticides, heavy metals, and industrial chemicals, has been linked to declining male fertility worldwide. Heat exposure is another modern concern. Frequent use of hot tubs, saunas, or prolonged sitting with laptops on the lap can increase testicular temperature. The testes are located outside the body for a reason. Sperm production requires a temperature slightly lower than normal body temperature. Small but consistent increases can impair sperm health over time. One of the most challenging aspects of male infertility is that it often has no obvious symptoms. A man may feel healthy, have a normal sex drive, and experience no pain or discomfort, yet still have fertility issues. This silent nature contributes to delayed diagnosis and unnecessary emotional strain on couples. Early evaluation is crucial, not only to identify treatable causes, but also to reduce stress and uncertainty. The emotional and psychological impact of male infertility cannot be overstated. Many men associate fertility with identity, virility, and self-worth. When faced with infertility, feelings of guilt, shame, anger, or inadequacy are common. Some men withdraw emotionally, avoid discussions, or resist testing out of fear of the results. This emotional burden can strain relationships and deepen isolation. It is essential to understand that infertility is not a personal failure, and seeking help is a sign of responsibility, not weakness. Diagnosis of male infertility usually begins with a detailed medical history and physical examination, followed by semen analysis. This test evaluates sperm count, movement, and shape. Hormonal tests, genetic testing, imaging studies, and sometimes testicular biopsy may be needed to determine the underlying cause. While the process can feel intimidating, it provides valuable information that guides effective treatment. Treatment options for male infertility have advanced significantly. In many cases, addressing lifestyle factors such as quitting smoking, reducing alcohol intake, improving diet, exercising regularly, managing stress, and achieving a healthy weight can lead to meaningful improvements in sperm quality. Treating infections, correcting hormonal imbalances, or performing surgery for conditions like varicocele can restore fertility in some men. When natural conception remains difficult, assisted reproductive technologies offer hope. Techniques such as intrauterine insemination and in vitro fertilization have helped countless couples achieve pregnancy. Advanced methods allow even men with very low sperm counts or sperm retrieval directly from the testes to father biological children. While these treatments can be emotionally and financially demanding, they demonstrate how far medical science has progressed in addressing male infertility. Equally important is the role of support and communication. Couples facing infertility must work together, sharing responsibility rather than assigning blame. Open dialogue with healthcare providers, counselors, and support groups can ease emotional distress and provide practical guidance. Mental health support is not optional in infertility care, it is essential. Public awareness about male infertility remains limited and myths persist. Some believe that infertility is always a woman's issue or that men with fertility problems are less masculine. These misconceptions cause harm by delaying diagnosis and discouraging men from seeking care. Education is the most powerful tool to dismantle stigma. When men understand that fertility is a shared responsibility and a medical issue, they are more likely to engage in prevention, early testing, and treatment. Prevention also deserves attention. Protecting reproductive health should begin early in life. Avoiding tobacco and drugs, practicing safe sex to prevent infections, maintaining a healthy lifestyle, and seeking medical advice for testicular pain, swelling, or hormonal symptoms can protect fertility. Regular health checkups help identify issues before they become irreversible. Male infertility is not just a private concern, it is a public health issue. Declining sperm counts globally suggest environmental and lifestyle factors that affect entire populations. Addressing these trends requires broader efforts, including workplace safety, environmental regulation, and public health education. Fertility health reflects overall health, and protecting it benefits not only individuals but future generations. In closing, male infertility deserves understanding, empathy, and open conversation. It is common, complex, and often treatable. By replacing silence with knowledge and stigma with support, we empower men and couples to seek help early, make informed choices, and preserve hope. Fertility is not a measure of manhood, it is a biological function influenced by many factors, most of which are beyond personal control. When we recognize this truth, we move toward a more compassionate, informed, and healthier society. Male infertility is far more common than most people realize, yet it remains one of the most overlooked aspects of reproductive health. In nearly half of all couples who struggle to conceive, a male factor plays a significant role, either alone or alongside female-related causes. Despite this reality, infertility is still widely perceived as a woman's issue. leading to delayed evaluation and missed opportunities for early treatment in men. This misconception places an unfair emotional burden on women and prevents men from recognizing their own role in the reproductive process. One of the main reasons male infertility is overlooked is social stigma. Many men associate fertility with masculinity, strength, and sexual performance. As a result, the possibility of having a fertility problem can feel threatening to identity and self-esteem. This fear often leads men to avoid medical testing, dismiss symptoms, or assume that fertility issues will resolve on their own. In reality, fertility problems frequently have no obvious symptoms, making professional evaluation essential even when a man feels healthy. Cultural attitudes and lack of education further reinforce silence around male infertility. In many societies, open discussion about male reproductive health is discouraged, and men are rarely encouraged to seek preventive care. Routine health checkups often focus on heart health or blood sugar while ignoring reproductive well-being. This lack of awareness means that treatable conditions such as hormonal imbalances, infections, or varicocele may go undiagnosed for years. Overlooking male infertility has real consequences. Delayed diagnosis can reduce treatment options, increase emotional stress for couples, and prolong the journey toward parenthood. Recognizing that male infertility is common and medically manageable is the first step toward breaking stigma. When men engage early in evaluation and care, fertility becomes a shared responsibility rather than a silent struggle. Sperm health lies at the center of male fertility, and even small changes in sperm quality can significantly affect the ability to conceive. For pregnancy to occur naturally, a man must produce an adequate number of sperm. The sperm must be able to move efficiently through the female reproductive tract, and they must have a normal structure that allows them to penetrate and fertilize the egg. When any of these factors are impaired, fertility can be reduced or, in some cases, completely blocked. Low sperm count, known as oligospermia, means there are fewer sperm available to reach the egg, lowering the chances of successful fertilization. In severe cases, sperm may be absent altogether, a condition called azoospermia. Poor sperm motility refers to the inability of sperm to swim properly. Even if sperm numbers are normal, weak or poorly coordinated movement can prevent sperm from traveling the long distance required to reach the egg. Abnormal sperm shape or morphology affects the sperm's ability to attach to and penetrate the egg, further reducing fertility potential. These sperm abnormalities can result from a wide range of causes. Hormonal imbalances can disrupt sperm production, while infections and inflammation can damage sperm or block their passage. Heat exposure, oxidative stress, and environmental toxins can alter sperm DNA and structure. Lifestyle factors such as smoking, poor nutrition, obesity, and chronic stress also play a direct role in reducing sperm quality over time. Importantly, sperm health is dynamic rather than fixed. Sperm are produced continuously, and their quality reflects a man's health over the previous several months. This means that positive changes, such as improving diet, reducing toxin exposure, managing stress, and treating underlying medical conditions, can lead to measurable improvements in sperm parameters. Focusing on sperm health allows both prevention and targeted treatment, making it a central and hopeful aspect of managing male infertility. One of the most encouraging aspects of male infertility is that the majority of cases can be properly diagnosed and many can be effectively treated. Advances in medical science now allow doctors to identify underlying causes with a high degree of accuracy through semen analysis, hormone testing, imaging studies, and genetic evaluations. Rather than being a vague or unexplained condition, male infertility is often linked to specific, manageable factors once a thorough assessment is completed. Treatment depends on the cause, and in many cases, relatively simple interventions can make a meaningful difference. Hormonal therapy is useful when infertility results from imbalances in testosterone or other reproductive hormones. Correcting these imbalances can restore sperm production and improve overall reproductive function. Lifestyle changes are equally powerful. Quitting smoking, reducing alcohol intake, maintaining a healthy weight, improving nutrition, exercising regularly, and managing stress have all been shown to enhance sperm quality and fertility outcomes. Surgical treatment can be highly effective for certain physical conditions. Procedures to repair varicocele, remove blockages, or correct anatomical abnormalities can significantly improve sperm production or delivery. These interventions often lead to natural conception without the need for further treatment. Even in more complex cases, medical options continue to expand. Assisted reproductive technologies provide solutions when conventional treatments are not enough. Techniques such as intrauterine insemination and in vitro fertilization allow sperm to be placed closer to or directly combined with the egg, increasing the likelihood of fertilization. Advanced methods enable the use of even very small numbers of viable sperm. The availability of these treatments means that a diagnosis of male infertility is no longer the end of the journey. With timely evaluation and appropriate care, many men can still achieve biological fatherhood and fulfill their family goals. Early evaluation and timely treatment play a critical role in protecting both fertility potential and long-term reproductive health. One of the biggest challenges with male infertility is that many men delay seeking medical help, assuming the problem will resolve on its own or feeling uncomfortable discussing reproductive concerns. However, infertility rarely improves without identifying and addressing its underlying cause. The sooner evaluation begins, the greater the range of effective treatment options available. Diagnostic tools today are highly reliable and accessible. A semen analysis can quickly reveal issues with sperm count, movement, or structure, while blood tests can uncover hormonal imbalances that interfere with sperm production. Imaging studies and genetic testing help identify structural or inherited causes that might otherwise go unnoticed. These investigations not only clarify the reason for infertility, but also guide personalized treatment plans. Treatment approaches are often less invasive than many men expect. Hormonal therapy can restore balance when testosterone or other reproductive hormones are abnormal. Lifestyle modifications, such as improving diet, reducing alcohol intake, quitting smoking, managing stress, and maintaining a healthy weight, can significantly enhance sperm quality within a few months. These changes benefit overall health as well as fertility. When physical issues are present, surgical options can be highly effective. Correcting varicoceles, repairing blockages, or addressing anatomical abnormalities can restore natural fertility in many cases. For couples who still face challenges, assisted reproductive technologies provide reliable alternatives. Modern techniques can achieve pregnancy even when sperm numbers are extremely low. Early action also reduces emotional strain. Prolonged uncertainty can cause frustration, anxiety, and tension within relationships. By seeking diagnosis and treatment early, men protect not only their fertility, but also their emotional well-being and future family. Building options. Male infertility is not a dead end. With prompt care, it is often a manageable and treatable condition. Early evaluation plays a vital role in protecting not only a man's fertility, but also his emotional well-being and future family. Building options. When fertility concerns are left unaddressed, uncertainty often becomes one of the greatest sources of stress. Couples may spend months or even years trying to conceive without understanding the underlying issue, leading to frustration, anxiety, and feelings of helplessness. Timely testing replaces doubt with clarity, allowing informed decisions rather than prolonged emotional strain. From a medical perspective, early evaluation can prevent irreversible damage. Certain conditions that affect male fertility, such as hormonal disorders, infections, varicocele, or testicular abnormalities, may worsen over time if left untreated. Delayed diagnosis can result in permanent impairment of sperm production or quality, limiting treatment options later. Identifying these issues early allows for timely intervention, which can preserve or even restore fertility potential. Early testing also expands future options. When fertility challenges are detected sooner, couples have more time to explore treatments, make lifestyle changes, or consider assisted reproductive technologies if needed. Sperm quality reflects recent health, so addressing problems early provides opportunities for improvement before more invasive procedures become necessary. In some cases, early evaluation also allows for fertility preservation, such as sperm freezing, before further decline occurs. Emotionally, taking action early can be empowering. Rather than feeling isolated or blaming oneself or a partner, men who seek evaluation demonstrate responsibility and partnership. Open communication and shared problem solving strengthen relationships and reduce feelings of guilt or inadequacy. Knowing that effective solutions exist brings hope and reassurance. Ultimately, early evaluation transforms male infertility from a source of silent distress into a manageable health issue, improving both emotional resilience and the likelihood of successful conception.